All right, we are live.
All right. Good evening, everyone. I'm Amy Hendricks, Deputy County Administrator, and I'm joined by some colleagues from Huga Health Systems as well as Tompkins County Health Department to discuss COVID-19. We've been having these conversations in town halls for nearly 2 years at this point, discussing a variety of issues and keeping the community informed. Tonight, we'll go ahead and have questions come in through the chat, and we'll help moderate that, as well as we have some prepared questions. Before we dive right in, I do want to introduce all of my colleagues joining me tonight. We'll start with Dr. Martin Stallone, CEO of Huga Health Systems, Claire Espy, Director of Community Health Services at the Tompkins County Health Department, and last but not least, Frank Krupa, Director of Public Health at the Tompkins County Health Department, as well as Commissioner of Mental Health for Tompkins County. So thank you all for joining us. And I see there's already several questions coming in, so we will take them. We'll start with the questions that are already here, and then we'll move to those in a little bit. First off, I do want to let you know about what has been going on since we last came together. One of the pieces is we have started our vaccination clinics for the 5 to 11-year-olds, and we've had a huge success with that. Currently, about 48.2% of our population in that age range has received their vaccine, and so we are seeing leaps and bounds to getting those young people vaccinated. A piece of that is really the commitment of the health department and how they've been leading that effort, while also maintaining all of the other areas of COVID disease surveillance. We also are going to be offering a Moderna booster clinic next week, and the appointments for that have already been filled. And by next week, I mean this weekend, I believe, the 11th. We also have continued to see low hospitalizations here in Tompkins County, although we did see a rise in cases following the Thanksgiving holiday. Currently, there are about 350 active cases, which means the health department has also been busy with disease surveillance and working with those people who have been identified as positive. Another piece that we're seeing, not yet locally, although we probably will see that locally and we'll talk more about it, is new variants and the Omicron variant emerging in the communities around us and elsewhere. So what does that look like and what's that mean for us? We have a lot of questions, as I have already said, so I'll dive right into the questions. And Frank, we're going to start by putting you right on the hot seat. And as similar to many of our town halls, Claire and Dr. Stallone, you guys can relax. We'll push a lot towards Frank, and then we'll get you guys to log in a little bit.
That works.
So Frank, we have seen an increase in positive case numbers. Is this largely following Thanksgiving holiday related gatherings and travel, or is it something else? Can you kind of tell us what can be shared about these cases and what we're seeing here?
Yes, yeah, a large impact has been from the holiday travel and folks either leaving the area and or gathering together for the holidays. And the one thing I do want to say about that is before Thanksgiving, we were telling folks it was okay, to have their Thanksgiving gatherings. We certainly offered suggestions around getting tested ahead of time. We'd always been recommending wearing masks indoors when you're with individuals that you don't live with all of the time. So yeah, I don't want the number increase to be something where we did something wrong. I think the general understanding is that we knew we would see some case numbers go up a bit after the Thanksgiving holiday. That being said, still the number one transmission route we're able to identify is in households, right? So what ends up happening is if somebody travels or they go to a gathering and they become positive and they come back home, the others that reside in their home with them, whether it's their family or roommates, tend to end up resulting positive as well. So it kind of, you see an exponential growth as more people get exposed. We're not seeing large clusters in other areas. We get asked that a lot. Where are people being exposed? We should expect that you could be exposed pretty much anywhere you go out in public, and quite frankly, in your own home if somebody else has tested positive. But there isn't a particular activity or event or location that we can point to say this is what has caused the increase. It really is just about being together more, the weather's colder, so we're inside more. People traveling for the holidays more. Those things are all opportunities for folks to get exposed and then come back to the community and potentially expose others.
All right. Thanks, Frank. I'm going to go over to Claire for this next one to ask, what do these new cases really tell us in terms of local prevalence and the degree of community spread? What are your nurses seeing at the health department?
Thank you for the question. In Tompkins County, the community transmission is considered high transmission, and that's by CDC standards. So we're seeing more than 100 total new cases per 100,000 persons in the past 7 days. And also more than 10% of NAATs that are positive during the past 7 days. I would like to mention that our priority is to prevent severe illness, hospitalizations, and death from COVID. So while we're doing our best to limit the spread of COVID among community members, we have seen higher transmission lately, but we're making progress towards two important goals, which include the vaccination of everyone that's willing to be vaccinated and having medication that can limit the spread of the disease and reduce its severity, helping us to prevent hospitalizations.
Thanks, Claire. Frank, back to you. So we're talking about diseases going to continue to spread. What do we continue to do to reduce our own risks? And will there be more mandates? Will government be mandating more things?
Yeah, we get that question a lot, Amy, and I can't speak for all of government, state and federal. What I can say is that here locally, we're not looking to use mandates as a tool or a main tool for addressing COVID anymore. We obviously encourage and have advised that everyone, whether vaccinated or not, should wear a mask while indoors. And so we support local businesses and other organizations in their efforts to require masks for either their employees, volunteers, or patrons. And we would encourage that. Mandates are the difference between our advisory and a mandate is enforcement. And really, our community has been so great throughout the pandemic and really doing what we asked of them from a public health perspective. Now, it's not perfect, and things certainly, you see fewer masks now than you did this time last year. But I think predominantly our community is trying to do the right things. And we're going to do some messaging and continue throughout the holidays to encourage that. We've created a new sign that we're going to be providing to businesses that they can hang up about mask wearing. And so that's really one of the most important things we can do. The most important thing is getting vaccinated, right? We need everyone that can be to be vaccinated. And while our vaccination numbers are high, they're not as high as we would want them to be. There are still populations that we need to get vaccinated. And yes, no vaccine is 100%. And we are obviously reporting cases in vaccinated individuals. But what it does do is, well, first of all, if you are vaccinated, you may get COVID, but you're less likely to get COVID than if you're unvaccinated. So that is still true. What is also true is that particularly if you're a younger person, and by younger person, I mean under 65, 70 years of age, you are less likely to need hospital care if you get COVID. So all of those things are extremely important for limiting spread. If we have fewer cases because more people are vaccinated, that's very helpful. If we're keeping folks out of the hospital, first of all, that's good for them and their health, but it is also good for our hospital, who, as Dr. Sloan will talk about in a few minutes, they're working really, really hard to keep hospital services available for everyone that needs them. And so every person that we can keep out because of COVID frees up resources for them to serve the broader community. So what we can do, please get vaccinated. Please wear your mask when you're indoors with around other people that are not those that live with you in your home. You know, stay away from large crowds. And most importantly, self-responsibility. We've been talking about this for a while. In almost every instance, if something doesn't look right or you're uncomfortable, leave the situation and make sure that you feel like it's where you are is a safe place for you to be, and folks are following the guidance that you'd like to see followed.
So Frank, as a follow-up, we've seen this spike in cases. Is this a precautionary tale for December holidays? And I'm going to couple that with another question that just came in about seniors who want to fly to see their family over Christmas holidays. Do you have any comments for them? Even if they have the booster, how can they be protected? So a two-part question now.
Sure. So the first one about the rest of the holiday season, yes, right. There certainly is those continued opportunities. People are going to travel. People are going to gather. Again, what we would ask them: please get vaccinated. Please wear a mask when you're indoors. Get a test before gatherings if you can. All of those things will help. But yes, we are likely to see disease numbers continue to be high and potentially spike again as we go through the holiday season. To your question about seniors, as we've been saying since the beginning, each of us has to evaluate our own risk. And certainly for seniors, there is more risk from COVID, whether fully vaccinated or not. So first thing, if you haven't gotten vaccinated, do that. If you haven't gotten your booster, get your booster. And then you have to make some decisions about what is best for you as an individual. And so that's going to be different for different people. Those that have underlying health conditions or maybe are immunocompromised, they're going to have to take some more significant steps to protect themselves than someone else might. And so I would just encourage folks to think about their own risk, weigh that risk against what it is they're choosing or not choosing to do, and then ultimately they have to make a decision for themselves. But continue to do the things that protect you: get vaccinated, get boosted, wear a mask, avoid situations that don't look safe to you, and then ultimately you've got to make decisions that you think are best for you, your health, and your family.
So with that, I'm going to transfer over to Claire for a couple questions talking about the cases once again here. And a question that came in is, do we really know why our cases are so high locally? And I'm going to couple that with the question that we had from before of, are there cases, clusters, and spreads that we're seeing, and what are they related to? Are they related through K through 12? Are they related to colleges, or is there something else?
Yeah, I think Frank spoke to this as well, so I'll just echo some of the things that he said. The increase that we've seen over the past 6 weeks or so in cases is likely due to more time spent indoors, gatherings, and local travel related to the holiday. We're seeing transmission predominantly from household exposures to positive cases, and we're seeing an uptick in cases among higher education in the past 2 weeks, and in general among the unvaccinated, including some K through 12. I think, there aren't any specific clusters. A cluster is defined as 3 or more laboratory confirmed infections among individuals with onset of illness within a 14-day period who are somehow epidemiologically linked and that don't share a household. So we are investigating and monitoring these closely. We found some recent clusters among employees at restaurants, bars, or retail facilities, as well as some school settings related to social life or transport. We're encouraged that in all of the above scenarios, the individuals and the establishments involved are taking appropriate measures and stopped the spread effectively.
And Claire, just to clarify, in the restaurant, bars, or facility, was that among staff or was that among patrons and staff?
Those were staff.
So it's people who are gathering together for periods of time and social interactions.
Correct.
All right. On that, I think it would be helpful to understand a little bit more about contact tracing, case investigations, and how you get this information. I know last week the health department announced that there's potential delays in some of these contact tracing and case investigations. Can you talk a little bit more, Claire, about the delays and also the process so people can better understand what it is your team's doing?
Yeah, thanks, Amy. And I think we are incredibly lucky to have a wonderful team working on COVID surveillance response and more resources than some of our neighboring counties. However, we are experiencing challenges to meet the demand and the quality that we have maintained. So just to give some context, Tompkins County Health Department at a local level, we're responsible for investigating all new COVID cases within 24 hours of receipt of the results. And that includes making an initial phone interview to assess and document the symptoms of the case, to determine isolation dates based on symptom onset or test date if the person's asymptomatic. We help the person support to safely isolate for the duration. We help them get any referrals to support resources as needed, and also to identify and enter the name and telephone number and exposure dates of any close contacts that the case may have encountered during what we consider to be their infectious period. So that begins 2 days prior to the isolation start date. And we enter that information into our database, and that then kicks off a process to be interviewed. The contacts are interviewed from the virtual call center, and those calls are made by the virtual call center, the VCC, who are under contract with New York State Department of Health to assist counties. So related to the timeline of the delays and how we're adjusting to the higher volume of cases, we get a lab test. Results can take up to 48 hours or more for test date, depending on where and when they test. The result comes into our health department within 48 hours of the test. Then we have a case investigation, and that's usually 24 hours, within 24 hours of receiving the results. And all of the contacts are entered by Tompkins County into CommCare. It's usually done at the same time as the initial interview investigation, but it can take up to 48 hours of that initial investigation in some contexts. For example, when the case themselves doesn't have all the information, we need to reach out to the school or to the employer in order to do that. And then there's a last step for contacts to be entered and to be reached for that mandatory quarantine. And that can take up to 48 hours of entry into CommCare. I will say that our priorities for entering contacts, we prioritize the K through 12 cases so that we're able to assist those families to plan and support the education of their kids.
And Amy, if I could just follow up on that. We can't talk about this without recognizing Claire and the team that does this work. I only wish the public could see behind the curtain just one time the sheer level and volume of work that goes into doing these case investigations. They're talking to people that just got a positive diagnosis and oftentimes are scared. They have a lot of questions. They're concerned about their family and friends. And the nurses and staff that are talking to the folks are doing amazing work in hopefully comforting those folks while doing the work of case investigators and then turning it over to the contact tracers. And while we are alerting the community that it might take us a little bit longer, please know that it is only because the sheer volume is beyond the capacity of the work that our staff are doing. And so please be patient with them when you're getting calls. And if you don't get a call right away and you're a positive case, isolate. That's what we're going to tell you to do. Isolate, stay home, stay away from other people in your household as best you can, but isolate yourself. You're going to be isolated for 10 days. So you can do that without, initially having heard from us. We will get to you. We will call you. We'll give you more information. We'll help you with the documentation that you might need for work, such as your isolation order or your release from isolation. So, just be patient, but understand that there is amazing things happening in the health department by the team that is managing to get the calls and make the contacts as quickly as they are.
Absolutely. Thank you for that, Frank. And Frank, you are a humble person, at least publicly, and that you didn't acknowledge the fact that a lot of that is due to the leadership there at the health department, and acknowledging that we have a high standard for how we're doing it and that our staff really are meeting with people with the care, compassion, and concern And so sometimes our calls may take a little longer than rather than just asking simple questions, because we do want to talk to each individual and really be able to be there for them. So thank you to all of you and your team. It's been a long road for all of you. With that, Frank, I'm going to ask you another question and then we'll move over to Dr. Stallone. But of positive cases who are fully vaccinated, are we seeing any trends in the symptoms of those? How are the symptoms being? And also, can you even explain why so many are in Tompkins County? We're seeing a lot more than probably other places of vaccinated people getting COVID. So can you explain why that's happening and then what the symptoms look like?
Yeah, so no, I can't necessarily explain it. What I can say is we know no vaccine is 100%, and we have a highly vaccinated population. And so therefore, we would expect that we're going to see more cases in our vaccinated population. It's important to say whenever we can that vaccines are designed not only to work in the individual, but in the community that the vaccine is entered into, right? So we've been talking about this from the beginning, that we're trying to intercept the transmission of disease from person to person. And the more people that we have vaccinated, particularly because they are less likely to have a transmission, it can still happen, but it's less likely, the better we will be. Because whenever there's a pocket of unvaccinated people, and in this instance, it's 20 to 30% of our population, that's an opportunity for the disease to jump to an unprotected host. And so every time that happens, it just continues to perpetuate the disease in the community, right? In that community that we're trying to protect with the vaccine. So I often hear, well, if you want to be protected and get the vaccine, then do that. Why does it matter if I do? Well, it matters because if you're not vaccinated and you're not added to that pool of people that it will be harder to infect, then you're another opportunity for the disease to move on and just continue to perpetuate itself. So vaccines are not just about protecting ourselves, they're about protecting our community as a whole. So that's part of why we're seeing what we're seeing, is we didn't get our vaccination levels to the place that we really needed them to be. And then the virus also doesn't recognize county borders, right? So vaccination rates around us in the country, and even around us in the rest of the world are not to those herd immunity levels that we've been talking about either. So it just gives the disease a continued opportunity to move from host to host. And therefore, it puts more opportunity for a vaccinated individual to be exposed to the disease and potentially have a case that breaks through the vaccination. So that was that part. There was a second part to that question, Amy.
What are the symptoms?
So in vaccinated individuals, generally speaking, they're milder. And we certainly see that from a severity perspective, when we're going to talk to Dr. Stallone here shortly, for our hospitalizations, particularly for those, under 75, 70, 65 years of age, our hospitalizations are predominantly unvaccinated individuals. And so from a severity perspective, the vaccine is working. It's doing its job. It's not the magic cure that everyone thought we're never going to see COVID again, but it is doing its job in that those that are being exposed and contracting COVID that have been vaccinated are seeing milder symptoms.
All right, I'll give you both a little break and we'll move over to Dr. Stallone to talk about CMC. And starting with, can you share a little bit about CMC hospitalization rates from COVID, and are we still within capacity?
Sure, I'd be happy to address that, and it's certainly a timely topic. Before I jump into that, I just want to echo, I think Frank gave a lot of, and Claire, great guidance, and I fully endorse the idea that vaccination is the most important public health measure at this point that the general public has control over cooperating with. I'd also like to echo the appreciation that we have for the staff at the Public Health Department, also all of the healthcare workers across the community who are enduring 20 months, upward of 20 months of this struggle. And, we really appreciate what everyone is doing. Before we get into discussing, it's somewhat an honor to come before you and talk about the healthcare system, while at this very moment, there are hundreds of people working and doing God's work. So to the point of hospitalizations from COVID and related capacity, I would start by saying I don't directly from COVID. I think the numbers are not striking. We have had high single digits, but into the mid-teens of COVID positive, potentially COVID positive patients. The vast majority of those patients require acute care, but not critical care. We are thankful that our vaccination rate is as high as it is here, although I echo Frank's guidance that we would like it to be even higher, because we do see within the population of hospitalized patients fewer severely ill individuals who are vaccinated. It's extremely so. And that is to say that almost all of the young and ill are unvaccinated, and certainly the medically vulnerable, you can be afflicted by COVID, but the protection is overwhelmingly obvious. And so, for each individual and those who the individuals come into contact with, the vaccine is a great thing. We are seeing an increased number of people coming into the hospital over the past few days. That's in keeping with the rise of cases stemming from the Thanksgiving holiday. So again, just for the record, this time last year, we had fewer hospitalizations than we do right now. And we were going into the winter months that were very severe in January, February, March. So again, this year is not been written. In terms of overall capacity, it's timely because you probably have seen in the news that over 30 hospitals have been limited by a gubernatorial order through the Department of Health to limit elective surgeries. That's really a consequence of the supply of capabilities. So whereas the number of COVID patients is not overwhelming at this point, the number of available staff members to take care of the number of hospitalized individuals is somewhat compromised. Put simply, we've seen a lot of departures from the workforce, and we are in the middle, and this is not a Cayuga Medical Center issue. This is a healthcare issue. There is a decided staff shortage. I would point out that some pharmacies are having trouble vaccinating individuals because of a shortage of individuals available to deliver vaccines. That kind of phenomenon is certainly happening. So in our surrounding community, the Rochester, Syracuse, certainly Cortland hospitals are right now restricted from performing elective surgeries because there isn't the requisite capacity. And so I did want to state what that is. The Department of Health asks hospitals to make sure they're not within 10% of their capacity. So to use simple numbers, if a hospital can serve 100 patients, if they go above 90 patients, they're in the red zone. And they would be, if they're in a region that's at risk based on case numbers, they'd be asked to limit elective surgeries. The Department of Health also looks at ICU capacity. So you could fail with general inpatient hospital capacity, or you could fail with insufficient ICU beds. With respect to Cayuga Medical Center, we've been fortunate that we've stayed above 10% capacity, but we have come close at different times. We get around this by active management on a daily basis. I wanted to just describe that we follow capacity on an hour-to-hour basis, and I give credit to our leadership team, our nurse leaders, our operational leaders that wake up really early in the morning, and really the sun never sets on this operation, and we look at how many cases are coming in the hospital, how many patients are able to be discharged. We also take into consideration patients in the surrounding communities that might need to be transferred to us. So as a matter of fact, about half of our COVID patients are from outside of Tompkins County. When we have capacity, other hospitals in the state know that we have capacity, and we do have an obligation to respond and provide that capacity. So we're in the very delicate position of making sure that we can perform the surgeries, the procedures, the routine care that our community needs. We can respond to the COVID number fluctuations in the community, and that we can be good neighbors to other hospitals in the state who are, by all accounts, struggling more than we are at this point. I would just end by recognizing, and I want to provide assurances, we are an outlier with respect, a positive outlier with respect to how few services that we have curtailed since the beginning of this. We did have a brief period where we went on hospital diversion. It lasted 8 hours, and we really regarded this as an intolerable event. The real cases in communities surrounding us, they're routinely going on diversion. They're almost taking turns, taking breaks, going on diversion. And I have argued, and we insist internally that that's not us. We really do need to remain operational, certainly from emergency services, but we also recognize there's really it's a false notion that there's elective surgeries that aren't important. They're just degrees of emergencies. And if you're a patient that needs an orthopedic surgery or some sort of a procedure that might be deemed non-emergent, it doesn't mean that it's not a big deal if we can't do that service for you. So we're trying super hard at great expense to hire the staff that we need to maintain staffing levels at the level that this community deserves, frankly. And so I don't want to say that it's easy. In fact, it's been the hardest thing that we've done since the beginning of the pandemic is to maintain those capabilities. But the good news is we're fully operational at this point, watching it super closely on an hour-to-hour basis. Capacity is a complicated subject, although it might sound simple at first blush, and we're doing well relatively. So Amy, if there's any point of that you want me to focus on, please ask a follow-up.
No, I think on the hospital capacity side, I think you've answered it all, but I do want you to comment a little bit about the trends you're seeing within the hospital and hospitalizations between the vaccinated status and unvaccinated status. Frank touched on some of this, but obviously it's a little more close to you and your staff.
Sure.
So if you could talk a little bit more about that, as well as the severity of illness, any of those kind of trends.
Yeah, I can also say that the number of this is an interesting fact that people hopefully will recognize. Our length of stay is a lot higher. So the amount of time individuals are coming into the hospital is actually increased. There's fewer individuals coming into the hospital relative to our historic average. That's a consequence of people being sicker, not just the COVID population, but there's been a huge impact of deferred care that has accumulated over the last year. So the first point I would make about our hospital environment is that we're taking care of sicker patients who are staying longer. We're also afflicted by the ability to discharge, transfer, and send to home with services. So we have more crowding there's a population of the hospital patients that are less sick at this point. And so that's also kind of afflicting us. Within the COVID population, again, I mentioned this briefly, but the sicker patients tend to be the older, medically more frail, and unvaccinated. And the vaccine, certainly in the younger population, provides exquisitely strong coverage against a critical illness. We rarely, if ever, see young people vaccinated who become critically ill or need ICU services or have those clinical endpoints that are unwanted in COVID. It's the vast majority of our ICU patients and those who have perished because of COVID are unvaccinated. And this just goes back to Frank's caution to everyone to get the vaccine and stop the ability of the virus to jump between individuals and reach the medically vulnerable, the old. So sicker patients overall, and within the COVID cohort, the unvaccinated constitute the sickest of the patients.
That mute button. You would think it would get easier with time, but I still forget it. We did have another question that came in regarding some Hugo medical facilities. And are you requiring masking at all facilities, including Island Health and Fitness and other places? And if not, is there a reason for that? Or will you be doing that?
Certainly in the medical facilities, we are across all CMA practices. So that's a fact at this point. And in an Article 28 governed hospital space, it's a Department of Health rule. In terms of non-medical spaces, we don't have control over non-medical. I believe at this point there is a mask policy at Island Health and Fitness, and I would remind that's not a Cayuga Health System location per se, but I believe they do have a mask policy in effect, and people I think can feel safe with those protocols, which are vetted by the infection control team at Cayuga.
Right. Thank you for that. And while we're back to masking with questions, I do have one more masking question. Some folks missed some of the discussion about mask mandates. So Frank, I'd like you to just once again discuss what a mask advisory is versus a mandate and why we've decided to stick under an advisory versus a mandate at this time.
Sure, Amy. So the county has had a mask advisory for everyone, vaccinated or unvaccinated, while indoors around others that are not members of their household for several months since we went into, as Claire described, a high transmission area based on the CDC criteria. We've had a lot of questions about why not a mask mandate. Really, the only difference between the advisory and the mandate is some form of enforcement. And the reality is, at this point in the pandemic, enforcement of a mask mandate would be nearly impossible. The resources necessary for it just don't exist. And it's a charged environment. And quite frankly, I don't think we want to be getting into arguments over mask wearing. We've got enough things to worry about. And what I would encourage folks is we are talking to our businesses. As I said, we've created some new signage to distribute to them to help, get the word out about wanting to have masks within their facilities. So hopefully that will help them get the word out. But really, for each of us, we have the opportunity in almost every setting to decide whether a situation is safe for us or not. And so if you're encountering a situation where people are not wearing a mask and you don't feel comfortable, leave that situation. That's the best advice we can give. I think our community has been good throughout the last 2 years in following the guidance that we've been providing. And we're hopeful that that will continue here as we move forward. So, we have an advisory. We're going to do some work to get more information about that out. We do recognize that, it's an opportunity for us to continue to, send that message and provide additional information for our community about it. But locally right now, we don't have a plan to add a mask mandate, just continuing to encourage people to follow the advisory that we have in place.
All right. Well, I'm going to shift us to talking about the Omicron variant. And Frank, I'm going to have you talk a little bit about what we know about that and what the symptoms look like. Are people sicker from this variant? What is going on? And can you talk a little more about that?
Yeah, to say that we don't know a lot. The variant is fairly new. It's only been identified for a few weeks now. And so it's going to take some time to understand whether it's what the symptoms will look like for that particular for the Omicron variant. So the one thing I would say is it doesn't change our treatment protocols at the hospital or any healthcare setting, and it really doesn't change any recommendations that we would make related to COVID. It's still get vaccinated, right? Wear your mask when indoors. Avoid large gatherings and such. So all of that, everything remains the same. We will obviously continue to monitor the information about Omicron, and if something changes or there's information that warrants us changing our approach, we will certainly share that as soon as we know about it. But I think right now we hear a lot about the Omicron variant, but really what's important is that we listen to the guidance and continue to follow that. Everything else, as soon as we know more, we'll certainly let folks know. I'll stop there because I think you have a next question that I was about to answer.
It's what happens when you can see my questions ahead of time, Frank. So let's talk about that sequencing for the variant. And is it being conducted locally? And can you explain exactly what sequencing means? Because I think that's a piece that people don't always understand, is what does a PCR test do and what is sequencing? Sure.
So first, the reason we have access to sequencing information is because of the great partners that we have at Cayuga Health Systems and Cornell University. They have put together the testing system that we have here in our community that allows us to offer testing at the mall location that's operated by Dr. Stallone's team in partnership with Cornell. And then Cornell's research folks are able to do the sequencing for us to tell us about variants in our community. The unique thing about this variant is there's something called an Gene dropout. And I know the very edges of this. The very smart people at Cornell and Cuyahoga Health have tried to explain it to me. So I'll share what I know. And there is this S gene dropout that can be detected through the PCR, the normal PCR testing that all samples are going through. So essentially, the PCR test, while also telling us if someone has COVID or not, is able to serve as a screening tool. So if it identifies that S gene dropout, those samples can then be prioritized by the folks doing the sequencing to let us know if there is Omicron variant in our community. It's around us. We've heard reports, I believe, in Oneida County and Broome County. It's not a matter of if, but when. So we will have Omicron here at some point. And once we've identified it, we'll certainly share that as soon as we can. One thing to point out about sequencing is sequencing isn't a diagnostic test. So it really isn't informative for the healthcare system about how to treat the particular individual. Because I know I hear folks saying, well, I want to know what variant I have. Why aren't you telling me what variant I have? The sequencing is a public health tool. It's a research tool to help us understand how the disease is evolving. It doesn't change how we treat the patient at this point. So the sequencing as it occurs is being done through Cornell, and it takes a bit of time. It's not something where we find out the next day after they get a sample. It takes time for them to run the results and then ultimately give us an idea of what variants are in our community. So I just wanted to make that clarification for folks. It really isn't about diagnostic for the patient. It really is a public health tool and a research tool so we can understand the disease.
All right. Well, thank you, Frank. And I was glad to hear you announced the S gene dropout in front of Dr. Stallone, and it looked like you still got it all correct. So
sounded good to me.
Here's another one. We'll see how you do with this about natural immunity, Frank. Can you explain what that is? And are people who have contracted COVID showing signs of natural immunity? Do they develop antibodies? And if so, how long does it last? And is that something that is similar to a vaccination or different?
Yeah, so there's a lot of questions in there. So natural immunity is what occurs when somebody is exposed to a disease and their body develops the ability to fight off that disease. Depending on the disease, our bodies have varying abilities to create immunity for us. Some you get exposed once and you're good, you're immune from that point forward. Other, you have some immunity. So if you're exposed again, you might have milder symptoms. And so for others, they don't generate any natural immunity after having been exposed. So there's varying levels depending on the disease. So yes, if somebody has been exposed to COVID, the likelihood that they're going to get COVID again goes down pretty dramatically. The second question about vaccinations, and I think the question was, do we require vaccines for somebody that's been exposed? The answer is yes, because the data tells us that if you've been exposed and then you are also vaccinated, the chances of you becoming positive again drop even more, right? And so that's why we encourage everyone to get vaccinated, even if you've been exposed before. And a lot of it has to do with the variants and the evolution of the disease as well. We don't know how, just as we don't know how every vaccine is going to respond to these new variants, we also don't know how any natural immunity that we might have is going to respond to those variants. So as we continue down the path of what is the future for COVID, it is really important that we get vaccinated so that way, even if we have some level of natural immunity, we're amplifying that even more by being vaccinated, which creates an even less likely scenario of the disease, transmitting to that individual.
I'm gonna, before jumping into boosters, I am gonna jump back to Claire for a moment. We're getting some questions again about contact tracing. And I will say, contact tracing, we do have some videos on the health department website. There's translated videos as well explaining the contact tracing process and what people would experience. But the question I have is, do you have to be a nurse to participate and be a contact tracer? And are you hiring for this or looking for volunteers to assist with contact tracing?
Yes, thank you. Good question. So we do all of our case investigations. That's the first interview that's done with a positive case in order to determine their isolation dates and contact trace. That's done by a nurse here at Tompkins County. We do work with other staff members, project assistants that we've hired to help to monitor positive cases once in isolation and help them monitor and document their symptoms and release them at the end of isolation. So that's a really important role. They also help with vaccine clinics and answer calls from the public. We have a team currently of about 30, including our permanent full-time staff who dedicate as much time as possible to the COVID case investigation and contact tracing efforts. But we do prioritize our permanent nurse time on vaccines, as those are the priority for our response. And so the team, we're always looking for nurses to do case investigations. So we have the position available for recruitment, and we also are hiring project assistants to help with the other work, and that's not required. A nursing degree is not required for that. So thank you.
And all of those positions are posted on the Tompkins County Human Resources website under open vacancies. So please check them out. And I know it's been a rolling hiring for the health department. As Dr. Stallone mentioned, we are experiencing need for nurses and other healthcare staff throughout all of our organizations. And so please continue if that's something that is your field. I am sure there are positions available in our community.
And we're a great team to join and be a part of. We do lots of team building activities, safe and distanced. So I think it's a good team to be a part of.
Dr. Stallone, do you want to make your pitch now? Good team to be a part of.
I was just going to say, I was going to start competing with you here for qualified available staff. Certainly, if kidding aside, if anybody is in a position to render clinical services, nurses, LPNs, medical assistants, if you're sitting on the sideline, we could really use you. And just like Claire said about the public health department, we have a variety of roles, all of which would greatly appreciate your contributions and expertise. So, and non-clinical positions as well. We have a range of job opportunities and lot of opportunities to visit cayugamed.org, and there's job listings there if anyone is interested in coming back into the workforce.
Well, thank you both for your promotional part of this broadcast. And now we'll go to talk a little bit about vaccines. And Frank, why don't you talk a little bit about that 5 to 11-year-old clinics and how they went and how many local youth were vaccinated and through those clinics?
Yeah, I mean, I'm a little biased, but I think they went really well. After tomorrow, we will have pushed through about 2,300 5 to 11-year-olds through their first and second dose. So they're on their way to being fully vaccinated 2 weeks after that second dose. And I think as you started, we're getting close community-wide to 50% of the 5 to 11-year-olds being fully vaccinated. The vaccine was approved about a month ago, and Thanksgiving was in there. So it is once again phenomenal the way that our community has responded and come out. We obviously still have work to do because 50% isn't 80%, which is where I'd like us to be. We are working with our local school districts. Next week, we'll be going out to a couple of the rural districts to start first dose clinics. And then in January, we'll be continuing those efforts, as well as relaunching our homebound booster program. So we're going to continue to try to get more of those 5 to 11-year-olds vaccinated. But I do want to offer a lot of thanks, Cuyahoga Health Systems, for allowing us to use the space up there at the mall. People are familiar with it. It is set up to, help us move large numbers of people through. And so having that space is invaluable. So thank you to Dr. Stallone and his team for allowing us the space. Our local pediatric offices, they came out early on. We had conversations about how it made the most sense to get the most children as quickly as possible. And they responded when we offered the opportunity to work together. And so they offered staff at the clinics to help with vaccinations. And that really played a role in our ability to kind of move the needle so quickly on getting the children vaccinated. So again, a community effort to this. And I can't not forget to thank all of the county departments that have supported us. As throughout the entire pandemic, the health department gets talked about a lot, but it really is a countywide effort. And we had staff from probably a dozen or more different county departments supporting those children's clinics up there. And they all did it with a smile and helped keep the kids calm and helped catch a couple runners that we had throughout the few days. But it really is a team effort. And I'm continually amazed by our community, both those that come out to help us make the events happen, but also those that are coming to actually be vaccinated in large numbers early. So we appreciate that. But I think generally the clinics were a success, and we're thankful for that.
And one group too is you had some community partners that provided some additional resources, Family Reading Partnership, Children's Reading Connection, as well as the Park Foundation to provide some things that were a little different than the adult clinics. So providing some food as well as toys, and I think there's a storyboard as well as books for all the young people that come. So it really has been a whole community-wide event to run.
Yeah, absolutely. Thanks, Amy. I neglected to mention those folks. Yeah, the atmosphere that those contributions created for the kids really made a difference. It really gave them distractions and an opportunity to walk away having received something at the clinic, which I think helped a lot of them come back for the second one. So it really was a great environment, and those contributions absolutely made a difference.
And I did want to provide all the youth whistles, but I didn't go there when we were purchasing those things. Those were going to be the Frank Krupa special. So every young person had a whistle in that space. Another piece today, the FDA did approve boosters for 16 and 17-year-olds. Do we know when they'll be available locally? Is that going to be another clinic, or what's the planning like for those boosters?
Yeah, so we are doing the large booster clinic this weekend that's already full. We filled 1,000 slots in a matter of a couple of hours. It is a Moderna clinic for 18 and up only, and just for boosters. We were not planning to be in the booster business as a county. Really, the plan was for local pharmacies and the healthcare, primary care healthcare providers to be the source for those booster doses. I think we've had a challenge here in Tompkins County, which is actually a good thing in that our demand outpaced the ability for those partners to meet. And so we've had a backlog, and it's been challenging to find appointments in Tompkins County. So let's first take that as a good thing, that we have demand and people want to get their boosters. And then, like I said, we have our clinic this weekend, but I'm hopeful that by getting that large group of folks done, it will loosen up some of the backlog for our other providers. But as Dr. Stallone mentioned, pharmacies, just like every other healthcare provider, are struggling with staffing and other issues to try to meet this new demands. They still have to dispense all the other medications that they've always done. So I would just encourage folks to be patient. For those that can travel, there are appointments available in surrounding communities outside of Tompkins County and pharmacies, so don't be afraid to check there if you have the capacity to get there. But we'll continue to monitor it after this weekend and through the holiday season to see how demand is being addressed, in those other systems. And obviously we'll reevaluate in the new year about any additional boosters that we need. I would certainly, for the children, under 18, certainly reach out to your pediatric offices if you're looking for a vaccine with them, because they're doing a great job of making appointments available for the kids that they serve.
And also on the vaccine piece, do people that are vaccinated and get the virus spread the virus for less time than people who get infected are not vaccinated? So it's that comparison of having the vaccine. And do we know any of the averages behind those numbers?
Yeah, I don't know the numbers on timeframes necessarily, but yes. So the vaccines are creating milder illness, and generally then that means there's less time that people are spreading and contagious. And so we definitely have seen a drop off in the contagious period of fully vaccinated people that do contract COVID. I don't know if Dr. Stallone, if you have any.
I don't know the specific number, but what you said is true. If you're vaccinated, you are shedding for a shorter amount of time, and the isolation period reflects that. So that's a fair statement.
All right, well, thank you for that. And are we seeing that people who are vaccinated early on, are they the ones more likely to have a breakthrough case? Is it because the vaccine is waning? Do we know anything about that?
I could just take that one. I mean, the vaccine effectiveness does wane over time. All of the curves are downwardly sloping, some more than others. It seems the Moderna has, better, longer lasting protection, although the initial studies showed equivalence. And that's really the reason for the booster, is that you regain the higher level of protection over time. And so the first class of individuals that the booster was approved for were the immunosuppressed, who didn't mount the same response to the vaccinations. So that's just showing that there does need to be a reinvigoration of the immune system. And something that was stated earlier, I just wanted to underscore: we don't understand the relationship between titers of antibodies and the effective protection. Really, the surrogate that was studied was the practice of being vaccinated with the specific vaccination. So all that's proven at this point is being vaccinated with the approved vaccines at specific time points. They wane over time. Boosters restore protection, and further studies are going to happen about the requirement for further boosters in the future, certainly.
Yeah, and just to kind of, I'm sorry, go ahead, Amy.
No, go ahead and finish this one, and then I have another follow-up on that.
Yeah, I just wanted to mention something about the booster doses too, because one of the things we hear out in the social media world is, oh, we're going to be having 8, 9, 10 boosters. Many of our vaccines are in a series, right? So when we're children and we go through our well visits, we are getting vaccines on a vaccine schedule. And many of those require multiple vaccines to build up the full immunity that we want to see in our body, right? So it's not uncommon for us to have a series of vaccine injections for a vaccine to be successful. And then on top of that, similar to the flu vaccine we have every year, because the strain of the flu that we're facing changes year to year. And so the vaccine is designed to try to reach the most common strains each year. And so that may become something that we do with COVID as well, right? But right now we're still in the beginnings of this, and we're trying to understand what having a series of vaccines means to our bodies as far as our long-term immunity against COVID. So the science is still out yet on what the long-term response to COVID will be based on what we learn as we go through these phases of having the vaccine in a series, and then seeing how our bodies respond to COVID in our communities.
And on that, Frank or Dr. Stallone, can you also comment? So we know that boosters are available now, 16 and 17. Do we see all age groups will be needing boosters in the future? Is there going to be waning for the vaccine? I mean, it's kind of a crystal ball question in some ways, but I think that's another concern that, parents are having, is it going to look the same as we look at different age groups?
I would just say the studies happened on adults first, and then the data was collected for children, which led to the approval of the 5 through 18 age frame, and it's certainly being studied. And I think in between Frank's answer the last time is we really should go step by step and not get ahead of ourselves on what's to be expected. It's not an implausible future that there would be boosters approved for 5 and above.
And do we have any timeline on when people under 5 may be receiving a vaccine? I didn't think so.
Pass.
No, not yet. It's obviously it's being studied, but as we've said throughout, it's important to move quickly, but it's also important to make sure we get it right. And so those studies will be done and then reviewed by the experts. And once they believe it's appropriate, then that's when we'll see the approvals.
All right. Well, we're closing in on our final questions. I do have one that came in about nursing homes, and that the governor has sent National Guard to assist with nursing homes in various areas throughout the state. But how are we doing locally, and how are our nursing homes doing in Tompkins County?
So I can speak to this a little bit. The National Guard deployment was a function of both the hospital impact and the nursing homes decreased capability. And so what I said earlier, I'll just repeat the main point is that not without struggle, we were able to maintain our capacity. And so we would not be a county where the nursing home capacity was increased. The real problem was nursing homes not being able to take patients out of the hospital and how that impacted the hospitals who were holding nursing home patients. And so in the cities around us, there are actual National Guard medics and other medical personnel who are augmenting the nursing homes for the purpose of decanting hospitals. And so we don't have that problem here. I do want to compliment the area nursing homes under the leadership of the Human Services Coalition, and our hospital personnel are having weekly meetings where we're doing bed management across all of those organizations as an example of the interorganizational collaboration that works during an event like COVID. So I think we're doing relatively well, not without challenges. They are equally strained from a staffing perspective, full of vulnerable, fragile patients. Just, you know, the demographics of those who live in skilled nursing facilities, but we're doing relatively well here.
Okay.
There was one point about, I think we didn't cover, just one reminder about the flu vaccine. Were you going to get to? Okay, thank you.
Where I'm going right now, I'm going to take us away from COVID and say, what about the flu? What are we seeing with the flu? And is it too late to get vaccinated for the flu this year?
No, it's almost never too late to get vaccinated for the flu. Yes, we would encourage everyone to get their flu vaccine. We have already seen an uptick in cases in flu here in Tompkins County sooner than we normally would in a year. And so flu is here and it's circulating in the community. And it has the same negative effects. If you're unvaccinated, you could end up in the hospital, and both for your own benefit to not be in the hospital and be healthy, but also to limit the impact on the resources, the limited resources that our team at Cuyahoga Health Systems has. So no, please, it's not too late. Go get your flu shot too. You don't have to wait between your any COVID vaccine and flu shot. You can go get it. So make your appointment and get your flu shot.
One caution, just when we talk about flu, it's reasonable to just think about non-COVID respiratory system illnesses, and the often cited excuse that this is not COVID. That's dangerous ground to tread on. I've personally heard people talk about symptoms and assuming that it's not COVID. We've got good testing capability in the county. If there's any symptoms that qualify as potentially COVID, regardless of whether you've had an immunization or a previous infection, the responsible thing to do is to quarantine and test and follow the good public health instructions that have been given. And so that's been the explanation of some micro clusters, is the assumption, the false assumption that a respiratory illness is not COVID because of the particular symptomology. So one caution I wanted to submit.
Yeah, it's a really good point, Dr. Sloan. Thank you for bringing that up. We have seen a lot of that, right? And Claire can probably echo this, that somebody goes and gets tested, and then the case investigator calls them up and they start asking about symptoms like, oh yeah, maybe 3 or 4 days ago I was starting to have a little bit of congestion, but I just wrote it off, right? We don't want to be writing off symptoms right now. That's really important. We need folks, as Dr. Stallone said, to take advantage of the available testing, and it's better to know than not know for both you and the people around you.
Right. I have one final question. As we start to enter a new year, often we start thinking about what we're hopeful for and what the new year will look like. And so I'm going to start with Claire, since it's her first time joining us. What are you looking forward to in the new year and as we start into 2022?
Thanks, Amy. Great question. I think I am looking forward to a time when the scope and length of contact tracing and case investigations that the health department is doing is much less than it is now. And that's partially, I'm just painting a picture now, partially due to lower case numbers, higher vaccine rates, and also increased sort of appropriation of behaviors by the community members, community leaders, organizations, employers, and schools. They're already doing it, but you know, if they test positive, they're staying home, and they're letting anyone that they came into contact with know, so they can get tested, and I think we'll make it through together that way.
Thanks for that, Claire. Dr. Stallone, what are you looking forward to in the new year?
Couple of things. I think I'm looking forward, well, you know, what are the aspirations for 2022? I think we want to show ongoing support and appreciation for the people that are doing great work. And I think I'm looking forward to continuing to make it clear that we really appreciate all the efforts that are ongoing. And that's with an eye of what we're going to need to continue to do. You know, with respect to our health system, I think my focus is on maintaining a very strong and capable health system. And I would reflect back on the successes that we've had so far. This is going to be popularized soon, but if you look at our, you know, event to date case rates and mortality rates, they really are outliers in the nation. We've really done remarkably well as a community because of how we've worked together, the testing availability, the public health protocols, the health system involvement. That is not a guarantee for the future. That kind of success is really, it takes investment, it takes fortitude, it takes the community being behind it. I am going to be challenging community leaders, people in a position to allocate resources to continue keeping our health system strong, to reconstituting the healthcare workforce through being a great place to work and continuing to be as successful as we've been to date. So that's what I'm focusing on for 22.
All right, Mr. Krupa.
Yeah, I hope nobody remembers what I said last year, because I think it was something about no more COVID and we wouldn't be doing these town halls anymore. And that didn't work out. But seriously, what Claire and Dr. Stallone said, I can echo as well. But I also just want us to be in a place where our community can feel normal, right? And by that, I mean, there's no more animosity. There's no more arguing. We understand what COVID is. We know how it works. We know what we can do to be safe from it. And we just do that. I think this year has been tough, almost harder than the first year, because, you know, in the first year we didn't know anything. And so everyone kind of just went along and understood we just had to do what was necessary. And then this year it was different. It felt different. It felt different as somebody doing this work in the approach and what you hear from different opinions, you know, about COVID and the response. And I don't want that for our community. I want us to be, you know, talking about important issues in front of us that we need to tackle, and doing it together. And my hope is that COVID isn't adding to the division that we're experiencing now. So I'm hopeful that in the coming months things will get to a place where people are vaccinated, disease numbers are down, and we're kind of just living with COVID as we know it, in a way where minimal people are needing significant healthcare for it, and we've all but eliminated death related to COVID. So here's hoping that we can not be having this town hall in December of 2022.
Yeah, I agree, Frank. I remember we had our last town hall, I think beginning of summer, we had announced it would be the final one, but we're back again. Similar to all of you, I'm hopeful that our partnerships continue. I think we have strengthened our partnerships as a community in a lot of ways, and we can build off of that and let go of a lot of, some of those barriers that Frank talked about that have been imposed by some of us, and help get through some of the opposition to a shared vision as a community. That's one thing that when we look at how we've weathered this, it's because the community comes together. We have those disagreements, we have those discussions, and then we move forward as a whole. And that's something I think that in some ways is unique to Tompkins County. So as we look into 2022, I also want to thank all of you for your leadership, the tireless efforts. We talked a lot about capacity and not having staff, but I think a piece of that is our staff are all doing double, triple, quadruple work. Just because COVID happened doesn't mean that the health department stopped all the other functions that it does. Some of those functions have been minimized a little, and we have staff that really want to get back to some of their other work, same with the hospital and other places, but we didn't stop. And that's really important. That's important for our community as well, is while we shifted how we were doing things, we didn't stop. And as we look into the future, we're going to continue on. So I wish everyone a happy holidays. Thank you all for joining us. Continue to mask up, keep your distance, get vaccinated. We've said it multiple times. That's the most important piece. We'll continue to provide updates through public health releases and in other ways, and come back into town halls as we need to. Thank you all, and everyone have a good night. Thanks.